CHS University provides a wonderful place to precept pharmacy students. It's a 100-bed hospital in North Charlotte, and we're part of the larger Carolinas healthcare system that has 42 hospitals. As a small shop, everybody knows everyone else, and it's easier to tailor the experience to the specific student needs. My name is Gene Merritt, and I've been the pharmacy director at university for 11 years. Prior to that, I was active duty Navy for 4 years, and then manager for a home infusion company for 3 years. I've been a pharmacist for 18 years, and have had the privilege of precepting students from a variety of schools in Maryland, Virginia, and North Carolina, most recently for the past 6 years with Wingate University. The best part of precepting for me is being part of the aha moments, the times where a student connects to what they've learned in class or from previous experience with actual clinical practice. These students are going to be our colleagues one day, and it's an honor to be able to help hand down some of the clinical and operational knowledge that they'll need to be effective pharmacists. The most challenging parts of precepting for me can be broken into 3 main areas: boredom, competition, and competence. Once the beginning areas such as basic pharmacy operations and IV prep are covered, it's sometimes difficult to find interesting topics to work on with second-year students. I have found that bringing up things that they're doing in class or going through specific patient cases tends to increase their interest and give them things that they're already more confident about discussing since they're already working on them. We also provide modules for increased learning in subjects like immunology, ID, and specific disease states such as diabetes, heart disease, and hypertension, things that they're going to be most commonly presented with in their future rotations and practice environments. It's also very helpful to find out up front what their career interest is. If there are disease states of particular interest, then that's usually a great place to start. Sometimes a student will be really honest and say, "I know that I'm not going to work acute care. I've been a retail tech and intern for years, and I really love that environment." That's okay, and we generally lean more towards some of the med-rec and outpatient areas to help keep their interest up. One of the other challenges in this category is what I call the house students. They've seen a lot of house or ER or those kinds of shows, and they want to go and see procedures or the icky surgeries that they don't feel like they've had a quality rotation. That involves a discussion of all the competencies that are required up front to be in an OR, but more importantly, the lack of knowledge value for a pharmacy student to scrub into viewing an operation. Most of what they would see would be from the back wall or the substerile area anyway, because surgeons aren't usually fond of having extra folks looking over their shoulders. The value for their knowledge base is talking to physicians, nurses, and patients to see what their perspectives are. One of the things I've noticed that most pharmacy students have in common is a sense of competitiveness. Sometimes this is a productive thing, and sometimes it isn't. Some students try to help their colleagues get through a task or discussion that they already know the answers for by either answering for them or reminding them of when they went through it, basically a collegial, helpful intent. However, some are interested in the grade, and they tend to jump in and gobble up as many of the questions or get as many right answers on the didactic portions as they can in order to show that they deserve the A. These are the challenging students because, even though they're usually extremely bright, they may not always be self-aware. In any case, one of the strategies for dealing with this is a one-to-one discussion and a clear delineation of expectations. From what I've seen, most folks can easily move from competition mode to helper mode pretty quickly if you let that expectation be known. In terms of competence, by competence I don't mean the student's competence, I mean my own. It's very difficult to stay up with all the current drug information and practice guidelines, and if a student has a particular interest in, say, cancer treatment or HIV therapy, I know I'm going to have to read up and be more prepared. This is a good type of challenge though, because it helps me to keep from getting complacent, and it certainly keeps me humble. We've had some success with rotations here because we try to make it as fun as possible while keeping it safe to make mistakes or just say, "I don't know." I will sometimes play games with drug recognition or drug mech while we're dispensing or going through patient profiles. We have 2 other preceptors here that also like to work with students, so it isn't just one person all the time, and we can give focused attention while letting students stretch their wings a bit. We also move from topic to topic pretty quickly, so most students don't have time to get bored. That said, sometimes it's a real challenge to keep things interesting. Not many folks want to talk about the Joint Commission for an hour. I remember being a new preceptor and making a lot of mistakes. Among the biggest was the perception that I had to be in teaching mode every second, and that I was expected to be a direct extension of the classroom. What I've learned over the years is that students already get enough didactic pharmacy in pharmacy school, and what they really want to see is how all that stuff they're getting tested on is being reused in the real world. They want to see the connections to actual practice, and they usually want to test their knowledge base to see what they know and what their gaps are. The only way that happens is if they feel comfortable that you're not going to pounce on them or belittle them or kill their grade if they answer something wrong. They also need to know that differences of opinion are okay. It is a privilege to teach students who will be the future of pharmacy. Thanks for your time with this presentation. If you have any questions, please feel free to contact me at the email address on the screen.